Mr. Jones. My name is Jakar. I'm going to be your nurse today. Can you verify your name and date of birth for me? Mr. Jones, 12/10/91. All right, for hand hygiene. All right, Mr. Jones, the doctor has ordered that we put in an NG tube today. That's going to be a tube that goes into your nose, down your throat, and into your stomach. That's going to help relieve all that pressure from your belly, okay? We're also going to pull some samples from that, okay? Is it all right if we go ahead and get that started for you today? Okay. First thing I'm going to do is bring your bed up, and then we're going to sit you way up. That's going to make this a lot more comfortable for you. This can get a little uncomfortable, so what I want you and I to agree upon is a signal where you can either hold up one finger or two fingers. And one finger means you just need me to pause for a minute, and two fingers means you want to abort completely, okay? Does that sound good to you? Yes, it does. All right, I'm placing the patient in high Fowler's position and bringing the bed up. I'm then going to perform hand hygiene, don gloves, then I'm going to just take a peek at your nose here. I'm looking for any lesions, I'm checking out your mucous membranes, and I'm also looking for any obstructions, and this is going to help me choose which nostril we're going to insert the tube into, okay? We're going to go ahead and go with this left one here. They both look good, but I think this left one is going to be our best choice. I'm going to go ahead and place just a small drape here to protect the patient's clothing. I'm going to open my tube. First thing we're going to do is measure the tube. We measure the tube from the tip of the nostril to the earlobe, then from the earlobe to the tip of the xiphoid process. Once we have that measurement, we're going to mark that stopping point with a small piece of tape, which I have already done. This is going to indicate our stopping point so that we don't advance the catheter any further. Then I'm going to lubricate the tip of the catheter. All right, Mr. Jones, I'm gonna have you take a nice deep breath. We're gonna start the insertion now. I'm gonna have you extend your neck backwards for me, okay? I'm just going to slowly insert the catheter, following the natural curve and floor of the nostril. Just very slowly inserting. Once Mr. Jones starts to feel the catheter at the back of his throat, I'm going to have him lean his head forward and start swallowing. He may take sips of water to ease the flow of the catheter if that helps him. He would not be able to do this if he was NPO. We're just going to keep slowly inserting. Until we have reached our stopping point. Once I have reached the stopping point, I'm going to take a piece of tape and very loosely secure the tubing to the patient's nose. At this point, I'm going to auscultate and aspirate for placement. So what I'm going to do now, Mr. Jones, is just listen to see if it is in your stomach, and then if it is in your stomach, I'm just going to pull out some stomach contents. I do hear the air bolus, so that confirms to me that the tube is in the correct place. I'm then going to aspirate a small amount of stomach contents and deposit that into a specimen cup. I'm then going to secure the tubing to Mr. Jones's gown. And check the pH of the stomach contents. I would then collect any samples or send this to the appropriate lab if that were needed to be done. Then I would wait for X-ray to also come and confirm placement of the tubing. Once that is done, I would then place suction as ordered. And make sure that it is secured. Then I would make sure that I have a NG securement device placed rather than just a piece of tape. Clean up any supplies, perform nasal and oral care, return Mr. Jones back to his original position with the exception of his head being greater than 30 degrees. Return the bed to a safe position. Discard any supplies, discard my gloves, perform hand hygiene, and document the procedure.